Back with internationally famous plastic surgeon Peter Fodor. He lives in LA, practices in LA, has a home here in Aspen. He's kind enough to come in and join us, give us a few pointers. And Peter, tell us about you. You know, it's interesting because plastic surgery at one time as a field, you did reconstructive surgery, burn surgery, hand surgery, and now there's been a sort of a split in the field where some surgeons like yourself specialize only in aesthetic plastic surgery, which means making you look better. So tell us about your practice.
Well, that's a really good question, and actually, you know, to be a good aesthetic surgeon, you first have to be a good reconstructive surgeon. But ultimately, the aesthetic procedures are a little harder to perform, believe it or not, than the reconstructive procedures. Reconstructive procedures are very heroic because you take somebody with burn or congenital malformations and turn them more towards normal, and that's wonderful. But when you look at somebody who's already good looking, comes in for you to have a little bit of a change, which is a fine tuning, that technically happens to be a lot harder, and the patients, the recipients, are much more critical. Because anybody in a car accident, in anything you do for them, they're very, very happy that you help them. But just the same, good aesthetic surgery's basis is reconstructive surgery. And I did it and taught it for quite a while, and I'm very happy that I've done that. The last 15, 20 years, my practice has been exclusively aesthetic in nature.
Okay, so...
But as far as my practice goes, just it's a little bit unique because more than 50% of our patients come from out of town, outside of the greater Los Angeles area. And then some of them come, like last week I operated on somebody from South Africa. Next few days we're going to do somebody from India, somebody else from England. But we operate on people from all over the country because nowadays people easily hop on the plane and go to get their plastic surgical needs taken care of by whomever they choose. Doesn't matter what the location is.
Okay, Peter, there's an old saying that beauty is in the eyes of the beholder. And so first of all, I'd like to, before we get into these photographs of classic beauties, I'd like to ask you exactly how you deal with a patient when they come in. Like if a patient like me came in who had a larger nose, you might say, well, do you want your nose fixed? But maybe you don't do that. Maybe I'm coming in because I don't like my ears. How do you do that?
That's an interesting point you made. And incidentally, you wouldn't be coming in to have your nose made larger, would you be, Jerry? That's not what you're asking. I want to make sure.
No, unless it would make me sexier, definitely not.
But the funny thing with that is it's what you hit it right on the head, because you have patients at times who have, let's say, a very large nose, a large nasal hump, and they have slightly protruding ears. And the plastic surgeon should never say and never assume, oh, you're coming in to have your nose done, because oftentimes that patient likes their nose, but they do not like their ear, amazing as that may be. And I've seen this happen many, many times. So I always let patients tell me what is that they would like me to look at. And then as the consultation goes on, we may very gently suggest, but very seldom. We don't solicit surgery. There's a big difference. For example, somebody has a very large nose, but a totally underdeveloped chin, which they never realize because all their lives they've been fixated on the large nose. If you reduce that nose to be in proportion with the small chin, you destroy that person's face, like Michael Jackson or whatever. So in that situation, you look at the entire profile, you compare it to the forehead, to the nose, to the chin, the two different thirds of the face, and then very politely you may something, I may not have to reduce your nose that much if I can put in maybe a chin implant. Let's talk about, but never solicit anything more. Similarly in body sculpting, if you have somebody that has outer thighs, the so-called rider's bridges large, and do not realize that also the love handles, which is the hip rolls, we call them, also large. If you reduce the thighs only, leave the hip rolls as they were, that person will have a rectangular back end, which is very unattractive. And so there are certain exceptions, such as this too, when you will say something about something else that the patient asked for. But as a general rule, I only address the issue that I was asked about.
And basically, every part of the body has to fit together like a piece of the puzzle. You can't change one piece without assessing how it's going to affect all the other pieces. The other thing that always interests me as well, when you look at people who come in for plastic surgery, sometimes people's unique abnormality may be the thing that makes their face interesting or beautiful. Maybe someone who has a certain type of eyes that maybe wouldn't be considered the most beautiful eyes, but on them, that's their feature.
That's another very good point, Jerry, because we have, when you think about the face, we have only about 10 major features. Let's say nose, eyes, chin, whatever. I don't go through that. And meantime, when you think, there are millions of people who look different, even though there's only those 10 different anatomic features that vary. And many times you can have somebody who has one or two features that are not very attractive, but it fits well with the face. And the analysis should come not only how can we produce a beautiful nose, but produce a nose that fits in the face. Same thing with chin, same thing with cheeks, and everything else.
And symmetry is important too, isn't it?
Well, it's amazing how many people are asymmetric. In my particular office, in every examination room, I have a mirror which is straight on when you look at it in one side, and you flip it around and flips the sides across. And when I do that, patients are so accustomed to being asymmetric, one side smaller than the other one, not until you flip it when the right side is on the left side and vice versa, they say, oh, that's not me. So it's normal to be a little asymmetric, and an attempt to totally correct asymmetry, unless the asymmetry is really, really bad, is not really a major goal.
Well, here's what we're going to do. Let's start out and talk a little bit. You were kind enough to bring in some wonderful photos, and we're going to show some classic actresses, and you can talk a little bit about what makes someone classically beautiful, what are the features that people would strive for if they want to achieve this kind of physical appearance. So tell us who these actresses are. You can read from it.
Well, I can see them, and I put these pictures together primarily to show, and I show these patients to when they come in for consultation, because especially when I look at noses, for example, a nose should not be coming out from the same cookie cutter when you do the surgery. And these examples are to show that these are all attractive faces with very different noses. And incidentally, Gloria Swanson, I talk only about patients that maybe are not alive anymore, like in her case. I did her last facelift, but she is very early in my career. But she is a wonderful lady. That she's up on the left, and there is Greta Garbo and John Crawford and Marlon Dietrich. And if you look at them, and I'm going to point a little bit, if that's okay with you, Jerry. Example on Miss Crawford, you see a very strong cheek area. So a big highlight there. Goes along with the strong chin, goes along with a rather strong and fairly long nose. The eyebrows are high. The forehead, the hairline is high. This all goes well together, and doing anything different for this patient, if she came in as a patient, would be a mistake. That's just one example. I could go through each of them. But I think it's important when you analyze every patient that comes to you is to provide those patients with a custom-tailored program for them, something that's unique to them based on their individual anatomic features and how they mesh together.
Okay, and in this photo we have Myrna Loy and Jean Harlow, more classical beauties.
Lana Turner and Vivian Leigh.
And the interesting thing about it is you can be beautiful, but they're all different.
Exactly, but here we go again. If you look at Lana Turner's nose, it's a smaller nose, it's a little bit turned up. This is a frontal view, so you can't see it sideways, but you know that slightly scooped out, as opposed to some other noses we're looking at other ones. It's just individually, and that's what makes it so exciting to find out in looking at the face what is the feature that maybe is out of proportion to the rest of the face. And that's okay to work on that feature. So the nose is not out of proportion, even though it may be large from somebody's face. You recommend to that patient not to have surgery because you would not doing them any favor.
Okay. And how often does someone come in and want surgery, and you look at them and you think they're not best by having surgery?
Well, I turn away a lot of patients, and how often? Maybe 30% approximately. And I turn them away on two accounts. One is they don't have an anatomic feature that should be fixed. And the other one, that the expectations are unrealistic. They could have something that I could make better, but if they expect such a premium from making a small difference, they think the whole life is going to change, the job situation.
The husband's going to come back, the dog will be found.
Exactly.
Right.
Which the husband coming back, that's a good point, incidentally, Jerry, because it's very important to do surgery on patients that are internally motivated. That's what I call it. It's not the husband saying, hey, go and have your breast enlarged or do this or that. And the patient maybe semi-unwillingly is accommodating the spouse or the significant other. That's not a good situation.
I just spoke with someone who said that, and that reminded me of this. She said her husband offered to buy her a boob job for her birthday. And I said to myself, well, he must be a boob.